So today is World Kidney Day.
I don't have any idea.
Oh, don't worry, you have an idea.
Happy World Kidney Day!
Exactly, happy World Kidney Day. We went to the street to educate the public about the kidney and also spoke to a pharmacist in the Cape Coast Teaching Hospital. Today is World Kidney Day. I'm here with
Priscilla.
Priscilla. What can cause kidney dysfunction, or what can cause your kidney to be diseased?
Alcohol, drinking of alcohol and smoking.
Thank you so much. Okay, so here, my heart is somewhere here. Your stomach is somewhere here. Where do you think your kidney is?
Is it at the back?
At the back.
Abdomen, around that place.
Smoking, taking too much of salt, and we should take more water into our body. And some of the medicine that we do, some of the medicine like trauma and those things will cause. And some people also decided to take medicine before they maybe have sexual affair with someone. That will can cause a kidney disease in our body.
Thank you so much. So, my heart is somewhere here, and my stomach is somewhere here. Where do you think your kidney is?
You say your heart is here.
Yeah, somewhere here.
And your stomach is here. My kidney will be here. Oh, I'm like. It will go on my left hand side.
Is it where?
Here. And we have two. So maybe one will be here and one will be here. Or they two will be on the same place.
Alright. Just watch me. Your heart is somewhere here. Somewhere here is your stomach. Your heart is somewhere here. Somewhere here is your stomach. Where do you think your kidney is located?
The back. That's your back.
That's very good. So how did you get to know?
They interview it as church.
Okay, that's good. That's good.
Could you?
What can cause your kidney to be diseased?
I think smoking and drinking.
Okay, that's good. Your heart is somewhere here, right? Your heart is somewhere here. Your stomach is somewhere here. Where do you think your kidney will be?
Maybe, yeah.
All right, well done. We are in Cape Coast Teaching Hospital. We have the opportunity to meet a clinical pharmacist by the name Dr. Kwame Jemfi John, who will be in the position to tell us a few things we need to know about our kidney as a pharmacist. This is the theme for this year's World Kidney Day celebration.
The theme for this year's celebration is Kidney Health for All, preparing for the unexpected, supporting the vulnerable.
Based on the theme that we have for this year, how can we tailor it down to the pharmacy profession?
Okay, the kidney plays an important role in maintaining the overall health of an individual. It has functions in maintaining homeostasis, working in concert with the heart to decrease slight elevations in blood pressure. It also helps excrete metabolic waste, amongst other important functions. And so as a pharmacist who is concerned with dispensing medicines to my patients to optimize their health conditions, I'd be concerned if there is any damage or insult to the kidneys, because these organs play a role in excreting metabolic waste products of the medicines we take in. A number of the medicines we take in are actually excreted by the kidney.
Thank you so much. Are there medications, over-the-counter medications, that can harm the kidney in any way?
Okay, a major class of over-the-counter medicines that actually have a role in helping to cause a decline in kidney function are the NSAIDs, what we call the non-steroidal anti-inflammatory medications. Examples include the very popular ibuprofen, diclofenac, celecoxib, among many other examples. So these medications can actually cause injury, which could be acute in nature or either chronic in nature, to the kidney.
Okay, that is a really important message. But how do these medications damage or harm the kidney?
Okay, as I stated earlier on, the kidney has a filtration function. Now, under optimal circumstances, it's supposed to carry out its function without any hindrances. But then when you take in the NSAIDs routinely, now short use of these NSAIDs would not cause any harm to the kidney. Let me state categorically. But then when they are taken indiscriminately, they can cause damage to certain parts or the functional units of the kidney. Now, the kidney has some small vessels that aid in what we call renal perfusion. There is the afferent arterioles. Now, when you take the NSAIDs inhibit the production of what we call prostaglandins. These prostaglandins functionally dilate the arterioles so that renal perfusion is optimized. When you take these NSAIDs in a chronic manner, or you abuse the use of these NSAIDs, they would function to inhibit the action of the prostaglandins. They will inhibit the production of prostaglandins, and so the vasodilatory effects on these afferent arterioles would not be, or would be hampered. When that happens, instead of these small vessels opening up or dilating, they tend to constrict or close up. When that happens, your normal filtration or the normal function of the kidney in filtering waste substances is impaired. And when that happens over some time, it can impair the glomerular filtration rate, what we call the estimated glomerular filtration rate. It will cause a decrease in that. And when that happens, when there is a decrease in EGFR, we are looking at either an acute kidney injury, and when that happens over time, it could proceed to a chronic kidney disease. As a form of public education, most a chunk of our population are on chronic medicines for the management of hypertension, management of diabetes, and other chronic conditions. Now, there is the tendency to go for OTC medicine, some of these NSAIDs, to manage pain. Now, let's say a patient is on, a popular angiotensin converting enzyme inhibitor, lisinopril, an ACI, for the management of their hypertension, or is on, an ARB like losartan, an angiotensin 2 receptor blocker like losartan, and also the person is taking a diuretic like, furosemide, and the person has or is experiencing headache. There is a tendency to go to any pharmacy or OTC, over-the-counter medicine seller, to get pain medication. Now, when you take these NSAIDs together with these hypertensive medications, be they lisinopril or losartan, plus your furosemide or your hydrochlorothiazide or your bromfluothiazide, and plus your diclofenac or your ibuprofen tablet, when these are administered together, they also increase the risk of renal damage, what we call kidney injury, by a similar mechanism to what I explained above. Now, ideally, your ACEIs and your ARBs are supposed to protect your kidneys in conditions like diabetes. They have renal protective effects. But then when you co-administer them with your diuretics and your NSAIDs, it increases the risk of injuring or getting an insult to your kidneys. And so I'd advise the public that when they are on these medications and they want to go for any OTC medicine, they should consult either their physician or their pharmacist or any qualified health professional for professional counseling. We can clamp down on the insurgence of these renal diseases.
Thank you so much. Thank you so much. This is beyond public lecture. So we are glad that you had time for us. And we will meet again on another health topic. Thank you so much, Dr. John, for your time. All right, my friends, please like, subscribe, and share. I'll see you in the next video. Thank you.